In Germany, they wound up with people who didn't want the AstraZeneca vaccine anymore.
Hey, bring it to me. I've got a wife, myself, and a child. This has not been tested in children yet, and I'd gladly give it to my 3-year-old son. So I'm afraid, asking to drive a limousine when you're actually trying to outrun, I don't know, a snowstorm or something like that is actually a little bit off color here. I think if people want to go on holiday, if they want to do the vaccine passports and all of that, they better take the vaccine that's available to them. And even then, I would say the skepticism generally should be about the new variants and the level of protection that we will get. We will be not ending up in ICU, but we might still get ill. And what the knock-on effect of that might be in the future is what we need to be paying attention. So let's reopen society and economy by getting vaccines on board, whatever vaccines come to us, and then start thinking about luxuries.
And in fairness to the UK Prime Minister, Boris Johnson's talking about booster shots of the vaccine come the fall because of those variants.
Yes. So first of all, originally there was a chance taken around boosting 3 months as opposed to within a month of getting the first dose. And a lot of us, including myself, said, hang on a second, we haven't tested this. Why are you so positive about something like that? There was a lot of scientific basis, but when it comes to giving drugs to people, you have to test what they do before you actually approve something for the general public. But it was a correct bet. And now this is going to be a good thing to go forward to boost with another dose 3 months apart. That creates time to make the new variant vaccines, and hopefully this whole strategy will work much better. I'm very much inclined to say that it's probably better to make sure that we get protection against the main strain, sustain a reasonable, not lockdown level, but reasonable amount of physical distancing between people, to not give breathing space to the new variants, and try to create time so that the studies are done properly, and also the virus itself can fizzle out in the absence of a transmission chain. If we get 78% suppression of transmission, we have a fighting chance to prevent those other variants from coming through. So let's just take what we know works.
Els Torreele, I wanted to ask you, what's your religion when it comes to all we've been hearing about AstraZeneca?
Well, I think that the key word here is we don't have enough transparency. We don't have enough transparency both at the level of the data, the study data. The way, and it's not just AstraZeneca, all of the companies, they have communicated piecemeal certain aspects of the data that they are seeing in their studies. With decisions of purchasing and starting to roll out already being taken before there were peer-reviewed scientific publications. We learn more in the press releases that are actually drafted for financial markets than in the public health media about what actually we have learned about these vaccines. And that, I think, has created also a lot of the space for worries and not well understanding and for miscommunication, etc. And then there is the question about transparency on the contracts. The whole discussion between AstraZeneca and the European Commission, but it's more broadly, we don't know what is exactly in the contracts, how much we pay for each of the vaccines. Why are these prices so different? When are they going to be delivered? And I think the bottom line there is that we need to realize that we have a system of pharmaceutical innovation where we leave everything, all the control, in the hands of a handful of pharmaceutical companies, and then from whom we are now dependent for the supply, for the knowledge, for the details about the safety and the efficacy of the vaccines. that I think is one of the reasons why there is also so many space for rumors and guessing. We're all guessing what exactly do we know about these vaccines. I know that the companies must have many more data than what we have today, because the data that we have are mostly based on interim analysis that some for Pfizer and Moderna date from November. We're 3 months later, and we haven't gotten any more data. And so I think this is, for me, the bottom line, that we need much more transparency, and therefore we need a much stronger public control towards the companies to demand that. We have so much leverage that we are not using, I think.
Dave Keating, are EU leaders demanding more?
Can I interject there a little bit?
Go ahead.
Sorry to interject there. I've done my time in large industry and pharma industry, so I can speak from both sides. I'm an academic now. The data that you're talking about are the data that's been disclosed to the public domain. Some of it's been published in peer-reviewed journals, etc. Great. There's a lot of data that goes to the regulators that you and I as academics never see. And I'm aware of that because I was one of those people putting the data in the hand of the regulators once many moons ago. So if the regulators are happy, then the governments should be happy. Now, I agree with you that individuals like yourself and myself can go out there and communicate that information more simply and more clearly to the lay public and improve upon the understanding and acceptance. But at the same time, we also have a responsibility to ensure that the information that's disclosed to the authorities is clearly told about as being clear to the authorities and not to the academics.